Hi there, it's Justin Lubino with Senior Advisors, and I'm excited to announce today that something we've been working on for several years in Washington, D.C. Was finally approved earlier this year with the Consolidated Appropriations Act of 2021. So these two key issues I'm going to discuss in this video are related to the effective date for someone's Medicare Part B coverage. So the bill that was passed earlier this year was a massive bill. Of course, it included a number of provisions on a number of different topics. But on page 2168 of this bill, there's information about simplified, it's called Beneficiary Enrollment Simplification, which basically fixes two problems that we have with Medicare Part B enrollment, and it'll be effective as of January 1st of 2023. So this is exciting news, and just want to create this short little video to explain the issues that are existing today and the fixes that are coming as of January 1st, 2023. So the first period we're going to be discussing and issues have to do with the initial enrollment period. So for Medicare, the initial enrollment period is basically a 7-month window that's built around your 65th birthday. So for most people, it's the month you turn 65, the 3 months before you turn 65, and the 3 months after you turn 65. That's the 7-month initial enrollment period for Medicare. Now, if you enroll in any of those 3 months before you turn 65, the effective date is going to be the first of the month of your 65th birthday, basically. If you enroll in the month of your birthday, then your effective date would be the first of the following month. Okay, so those are both very logical rules that are in place today. Where it starts to get a little bit confusing, and also where people get hurt with this effective date delay, is if you enroll in any of those 3 months after your 65th birthday. All right, this is still part of your initial enrollment period, but there's a delay in your effective date. So, and this happens to a lot of people that are working past 65. They don't realize, I'm just going to work for an extra month or two. Even if you have group coverage through an employer, it doesn't matter. If you enroll in those 3 months after your 65th birthday, you're going to have a delay in your Medicare coverage. So if you enroll 1 month after your birthday, you have a delay of 2 months after you enroll. If you enroll in 2 months after your birthday or 3 months after your birthday, you're going to have a delay of 3 months after you enroll. Okay. The new rules that are going to fix this as of January 1st, 2023 are going to give you the first of the month following your enrollment. So that makes more logical sense. If you enroll 1 month after your birthday, you get the first of the following month. 2 months after your birthday, you get the first of the following month, and same with 3 months after your 65th birthday. So this is much more logical, and it doesn't have that delay where people get hurt with the delay in their coverage. So to try and just make this a little bit clearer, because I know it's a little confusing, here's a little example for someone that's turning 65 on September 15th. All right. If this person enrolls anytime between June 1st and August 31st, those are the 3 months before the birthday month, they will get the first of their birthday month, which is the first of the month they turn 65, which is September 1st. That's going to be their effective date. If, however, they enroll between September 1st and September 30th, they will get the first of the following month, which is October 1st. And then where it gets a little bit, again, confusing is if you enroll in those 3 months after you turn 65. In this example, if they enrolled in the month of October, they would get a December 1st effective date. If they enroll in November, they would get a February 1st effective. And if they enroll in December, it would be not until March 1st effective for their coverage. So this is the problem that we were just describing. This is an example of it. The new rules, which will take effect in 2023, are going to give the first of the following month. So if you enroll in October in that example, you would get November 1st. If you enroll in November, you would get December 1st. And if you enroll in December, you will get January 1st. Much more logical approach. This is something, again, we've been working on in Washington, D.C. for probably been 4 or 5 years. We had a bill drafted. It was called the Bennies Act. And essentially, it was going to fix this problem. The actual Bennies Act did not get approved, but they took the language out and they put it into this appropriations bill that was approved earlier this year. So very exciting that this will be resolved in after January 1st, 2023. The other issue has to do with the general election period. So this time period, and I know there's a ton of election periods of Medicare, so it gets really confusing, but this time period is only for people that have missed their initial enrollment period. So they didn't enroll when they were 65 in Medicare. They don't have other credible coverage through an employer plan. If you miss those windows, then this is the only time you can enroll, which is January 1st through March 31st. And your effective date for these individuals will not be until July 1st. Okay, so you've got this, you got to wait, number one, to enroll if you missed your window. And then once you're allowed to enroll in that window of January 1 to March 31st, your effective date is not until July 1st. So again, there's this long delay of no health insurance. You can't go buy an individual health insurance plan when you're Medicare eligible. So you really have no health insurance until this coverage kicks in. With the new rules coming in January 2023, anyone enrolling during the general election period will get the first of the following month for their effective date. So again, this gets rid of that delay, makes it much more logical, and you know, it's much more positive for the Medicare beneficiary. So this table just explains that, you know, the current rule, again, if you enroll during that general election period, you'll have a July 1st effective date. In the new rule, starting January 23, you will get the first of the following month. So here's an example. So if you enroll January 1st through January 31st, the current rule, you will get a July 1st effective date. The new rule in January of 23, you'll get a February 1st effective date. If you enroll in February, you will get, again, current rule, July 1, new rule, you'll get March 1. If you enroll in the month of March, you will get, current rule says July 1, and the new rule will be April 1st. All right. So these are both very positive changes for folks that are in these windows. When they are enrolling in Medicare, they will get their coverage sooner, and they won't have a gap of health insurance. So we're excited about this. We've got several other initiatives we're still actively working in Washington. We have other videos that explain the COBRA trap, the observation issue that we're working on, and others. So hopefully we can get some of those over the line as well later this year, and hopefully not too far out. And thank you for watching this video. If you want additional updates, you can subscribe to us on YouTube, like us on Facebook, and you will get our future updates as well. So thank you for watching. Take care and have a great day.